All right, picture a nurse in your head right now. What exactly are they doing? Are they checking a pulse? Maybe handing out medication? Adjusting an IV? Well, if that's what you pictured, you're not wrong, but you are barely scratching the surface. Welcome to this explainer, where we are going to completely dismantle your assumptions about what nursing actually entails. So, I've got to ask you directly, what does a nurse actually do? The general public almost exclusively associates the nursing profession with simple, direct physical care. And look, while that is absolutely a vital component of the job, framing the entire profession around just that one task, it's incredibly limiting and it really doesn't reflect the reality of what they do every day. Okay, let's dive right into this. According to the foundational standards of nursing practice, a professional nurse functions in not one, not two, but literally 11 distinct career roles. Get ready for this. They act as a caregiver, a counselor, a teacher, a client advocate, a change agent, a communicator, a team member, a resource person, a leader, a decision maker, and a researcher. Yes, you heard that right. All of those responsibilities fall squarely on their shoulders. And what's really wild is that these roles, they aren't neatly boxed into different shifts or scheduled for different days of the week. They overlap every single day, often minute by minute. A nurse might be a caregiver one second and a critical decision maker the very next. And honestly, that can lead to a real conflict in expectations and responsibilities as they try to keep all these plates spinning at once. It's kind of like being an air traffic controller, but the planes are human lives. So, to make sense of this whole complex profession for this explainer, we're going to group these diverse roles into 4 concentric circles of impact: beyond the bedside, healing mind and spirit, the patient's champion, and shaping the healthcare system. Number 1, beyond the bedside, shattering the stereotype. First up, we got to acknowledge the foundational caregiver role, because it is the one we all recognize. When clients are unable to meet their own needs, the nurse steps right in to provide direct physical care. But this actually ranges really widely, from providing total care for a completely dependent patient to supportive, educative care to simply helping a patient with illness prevention. So it isn't just treating a sickness, it is proactively preventing it. There's this fantastic quote from the source text: "Holistic care emphasizes that the whole person is greater than the sum of their parts." And wow, does that perfectly illustrate why the caregiver role goes so far beyond just the physical. It completely changes the narrative. True nursing care has to include the psychosocial, the developmental, the cultural, and even the spiritual needs of the patient. They're treating the whole person, not just checking off a list of physical symptoms. Moving to number 2, healing mind and spirit, the unseen support. Now, one of the most critical, but honestly most invisible roles is that of the counselor. Counseling in nursing isn't about just bossing patients around or telling them what to do. Instead, the nurse is there to facilitate client action. They help patients recognize stressful psychological or social problems, assist with resolving them, and ultimately help build up the patient's own coping skills so they can make their own informed choices. It's essentially therapy built right into the healing process. I mean, think about the incredibly heavy emotional situations nurses guide patients through every single day. They provide counseling and stress management. They help folks grapple with lifelong chronic conditions, and they navigate the truly devastating waters of grief and bereavement. For counseling to be effective in this profession, it has to be holistic. It has to address the emotional, psychological, spiritual, and cognitive dimensions of human suffering. And going hand in hand with counseling is the role of the communicator. Nurses understand that any barrier to effective communication can actually halt the healing process in its tracks. So they have to communicate clearly and effectively, not just verbally with patients, families, and the rest of the healthcare team, but also through really rigorous written communication. Meticulous patient charting is absolutely key to making sure there's a safe, seamless continuity of care. All right, part 3, the patient's champion, empowering the individual. Here's where things get really dynamic. Nurses are constantly trying to shift patients away from being passive recipients of care into becoming empowered partners in their own care. That is the client advocate role in action. A lot of the time, patients or their families might feel a bit intimidated and they won't bring up their real concerns to the doctors, but they will tell the nurse because they've built that bond. The nurse acts as an advocate by listening to those hidden concerns and actively integrating those wishes right into the care plan. Now, obviously, you can't empower someone without educating them first. Enter the role of the teacher. Teaching is
totally intrinsic to nursing. It's an active, nonstop process of sharing information to help make real behavioral changes happen. A nurse literally views every single interaction as an opportunity for learning. Whether that teaching is formal, informal, super intentional, or just completely incidental, the educational process is always running. They're basically translating highly complex medical language into actionable everyday steps for their patients.
Sometimes, though, empowering a patient just means pointing them in the exact right direction. As a resource person, the nurse looks at a client's specific strengths, and this includes everything from their physical and intellectual capabilities to their economic, social, and environmental access to resources. By getting a read on this whole picture, the nurse can step in with skilled interventions and make those crucial referrals to outside resources that the patient desperately needs. So, the crucial point here is that all this advocacy, teaching, and resource management, it requires a massive amount of critical thinking. A nurse is running this continuous loop: assess the patient, identify the problem, plan and implement interventions, and then evaluate the outcomes. This never-ending cycle of clinical judgment is the intellectual engine driving the nurse to figure out the absolute best course of action in real time. It's high-stakes problem-solving happening quietly right behind the scenes. Which brings us to part 4, shaping the healthcare system, from bedside to macro-level impact. There is a massive difference between just being reactive and being truly proactive. Nurses act as change agents. They know that driving change in healthcare is a wildly complex process. They don't just sit around reacting randomly or waiting to respond to things after the fact. They are proactive. They take the initiative to plan changes out carefully and implement them deliberately to facilitate actual, tangible patient progress. And to drive that kind of change, well, you have to be a leader. And this leader role applies absolutely everywhere. A nurse's influence targets individual clients, their families, entire groups of clients, their professional colleagues, and even the broader community. Effective leadership at this scale requires a really deep understanding of what actually motivates people to accomplish specific, vital health goals. Of course, a leader is honestly nothing without their team, right? The nurse is a vital team member. They absolutely do not function in a vacuum. They rely on strong interpersonal and professional communication skills to build healthy, highly collaborative relationships with both clients and their colleagues. And it's this constant, seamless collaboration that ensures a true continuity of care for the patient. Now, if you've still got any lingering stereotypes about nursing knocking around in your head, this last role is going to shatter them completely. Nurses are researchers. They are literally scientists who study various aspects of health, illness, and healthcare delivery. By designing and running rigorous scientific studies, nurse researchers are actively hunting for new ways to improve health services and revolutionize care outcomes for everyone. That's a pretty far cry from simply checking a pulse, isn't it? So, take a quick second and reflect on your own healthcare experiences. When you're interacting with a nurse, what are you not asking? Knowing now that the person standing in front of you is a counselor, an advocate, a resource person, a teacher, and a clinical decision maker, think about how you can better utilize their vast expertise. What questions should you be asking your incredibly multifaceted nurses the very next time you see them? As we wrap up this explainer, I really hope a simple thank you carries a little more weight for you now. The true depth of a nurse covers 11 totally dynamic, overlapping roles that balance deep empathy with hard science and critical leadership. Understanding the massive complexity of this profession should forever change how you view your healthcare team. So I'll leave you with this final thought. The next time a nurse walks into the room, are you going to just see a caregiver, or are you going to recognize the actual backbone of the entire healthcare system?